Morning everyone, we're just going to give it a few minutes and let everybody have a chance to join. Hi everyone and welcome to our Frontline Network Annual Conference 2023. My name is Viki Fox and I'm Policy and Participation Manager and Service Manager for Cyrenians, which is a homelessness organisation based in Edinburgh and the surrounding areas. I've also been a St Martin's in the Field charity trustee since 2020. We're delighted to have frontline colleagues tuning in from across the UK for a packed day of sessions on this year's theme of working together, strengthen community, and we have over 500 people signed up for today. At this year's event, you'll hear from a wide range of people who are working together across the UK. Our focus on working together feels more timely than ever, given the scale of the challenges we face and the need for us to take coordinated action to address homelessness. Working across different settings and sectors strengthens how we share best practice, insights and learning. There's strength in working together, there's strength in community. Today, we want to recognise the important work being done by frontline workers and provide a space for learning and reflection. We need to work together, both as we respond to immediate need in our day-to-day roles and to achieve real systemic change around homelessness. We recognise the profound impact that sustained funding cuts, COVID-19 and the ongoing cost of living crisis are having on us all. People experiencing homelessness, frontline staff and organisations across the UK are adversely affected. Working together as a community strengthens our resolve as we strive to effect change together. It can offer support where it's most needed and remind us that we are not alone in our experience. We are part of a group that is listening to our concerns and a community that wants to support us. Collectively, we can raise our voice and share our insights to inform the wider change to policy and practice that is vitally needed to address homelessness. We hope that you find this event enjoyable and take away information that's helpful, inspiring and can apply to your work practice. So I've got a few key bits of information about today's event. We've got a packed schedule for you today, but at the same time, we appreciate you might not be able to stay for the whole event, so please feel free to join us for one session or the entire day. We've factored in breaks throughout the day, but please feel free to do what you need to during these sessions, as although you'll be able to see us, we won't be able to see you, so munch away on those noisy crisps. All of today's sessions are being run as webinars. We will be recording and sharing most of these on our website afterwards, so not to worry if you couldn't decide on which session to attend, you can always watch them later. Throughout the day, please get involved by sharing comments and questions via the chat and Q&A box. Just a reminder, please don't use these functions to share confidential information or inappropriate comments. If this happens, we'll need to remove this feature. And lastly, please join our conversation on Twitter. We are at SMITF_frontline and the hashtag is #workingtogether. We've got a fantastic lineup for you today. Very shortly, I'll be providing an update on what we've been up to at the Frontline Network. And then we're excited to have a four-nation roundtable discussion with me plus Katie Dalton, Director at Kimry, and Mark Baillie, Policy and Public Affairs Manager from Homeless Connect in Northern Ireland, as well as Jeremy White, Head of National Partnerships at Homeless Link. The morning sessions that follow will share information, resources and best practice around specific aspects of homelessness, including healthcare, housing legislation, access and support for people in temporary accommodation and immigration. After lunch, we have a roundtable panel discussion on how best to support the well-being of frontline staff. This is followed by 3 sessions focused on frontline resilience and practical tips to support your well-being. These include webinars about mindfulness and self-care, resilience, and a workshop on boundaries and well-being. But before we go any further, we need to see who's in our virtual room. We love our icebreakers, so please get involved. To participate, please go to menti.com and enter the code on your laptop, phone, or any other device. Alternatively, you can scan the QR code or just click the link and we'll be sharing in the chat just now. We'll just give that a few minutes to let everybody get onto Menti, and then we'll start sharing the results. Brilliant, great to see so many names up there. And in the chat as well, thank you. And it's raining in Cambridge. Good stuff. And where is everybody from in the UK today? This is a test of your geography. Somebody here from Switzerland. So we've got a nice spread across the UK. Brilliant, that's great. And it'd be good to see how many of you have attended a Frontline Network event before. So those answers are coming in. We've got a lot of people that haven't been with us before, so welcome to you. And for the ones that are coming back again, I hope that you enjoy this year as much as you have done previous years. Brilliant, thank you. And this is a more difficult one. What's the personal quality you value most in yourself? Great, so we've got a couple of integrities there, a couple of empathies, resilience, integrity, seen a couple of compassions, few compassions, yep, oh, compassion's popular, got a lot of compassionate people with us today. Kindness, brilliant, diligence maybe. Fab. Brilliant, optimism, that's a good one. Humour. fabulousness. It's great, it's good to be fabulous. Brilliant, thank you. And if you could have one superpower, what would it be? So another one to think hard about. Invisibility, that's a popular one. We went through these the other day and I chose invisibility, but then somebody else had picked time travel, and I wished I'd picked that. I had a really interesting discussion with my son the other day. We were watching Doctor Who about would it be better to travel forward or backward in time. And yeah, I'm not sure about that one, but it would be a good superpower. Telekinesis, flying, winning the lottery every week. Eating anything, yeah, that'd be a good superpower. It's a lot of time travel. To teleport so there's no commute to work. Extendable arms. There's some really creative ones in here. Power of persuasion, we've got in the chat, solving problems. Yeah, time travel and invisibility seem to be favourites, I think. There's only one extendable arms that I've seen. Fabulous, that's great. Thank you. And before we start our roundtable discussion, I know there are quite a few people joining us today, as we've seen from the Mentimeter, who are new to us. And even for familiar faces, it's been a busy year and since 2022 conference. So I'd like to take the opportunity to share some of our work that we've been doing alongside you. For those of you who are new, we launched the Frontline Network back in 2016 because we recognised that there was more we could do to support frontline staff working with people experiencing homelessness. By frontline staff, we mean anybody who works with people experiencing homelessness in the public, statutory or voluntary sectors, for example, working in outreach, housing, charity, social work, health or probation. The network works at both a national and local level to support staff offering funding, community and resources. Many of you will know us for our Vicar's Relief Fund, which provides small, quick grants that prevent eviction or help people access accommodation. As a frontline worker, you can apply for a grant on behalf of someone you're supporting. In 2022 to 23, you submitted a total of 5,356 applications to the VRF. Thanks to the generous support of our donors, we were able to make a total of 4,832 grants, spending £1,768,762 to support 8,086 beneficiaries. As well as providing funding to support people experiencing homelessness, we are delighted to have relaunched our training fund this year. The fund supports frontline workers through grants to access training and develop their knowledge and skills where cost is otherwise a barrier. Find out more on our website. The address will be on screen all day. During 2022 to 23, we awarded 26 grants totaling £49,916, which allowed 270 staff to attend training through a combination of individual and group training on subjects as diverse as trauma-informed practice, universal credit with complex needs, and complex trauma. We also provided a 50% subsidy towards 48 frontline workers undertaking the Level 3 certificate in providing homelessness services provided by Homeless Link and accredited by the Chartered Institute of Housing. This was a new programme for the year. Last year, we announced that 6 organisations who support our vision of everyone having a safe place to call home and support they need had been successful in our new funding round to make available £1.5 million over 3 years. In the first year of funding, £398,279 was allocated among the 6 frontline organisations: Caring in Bristol, TGP Cymru, Legal Services Agency, AKT Pathway and Extern Northern Ireland. We are excited to be announcing the recipients of our recent funding round very soon. This invested a further £600,000 over 3 years to organisations specifically working on the issues of mental health and homelessness. We also work at a local level with a community of partner organisations across the UK. Through these local networks, we regularly bring together staff to connect, share expertise and link to decision makers. In total, 78 local events took place alongside 15 national events, providing regular opportunities for frontline staff to come together and effect positive change in the sector. If you're based in Scotland, then you might have taken part in our conversations about prevention practice over the last year. In Wales, perhaps you caught coverage on ITV which discussed the experiences of frontline staff affected by the cost of living crisis. Or if you're in Northern Ireland, you may have been part of the conversations on workforce challenges and supporting staff well-being issues which were raised at the Assembly. And for those of you in England, you may have attended one of our local networks across the country hosting a whole range of events and training. So wherever you are located in the UK, there are opportunities to connect with others and share your insights. Another important part of our work at the Frontline Network is amplifying your voices to decision makers. We know you have a first-hand insight into how to prevent and relieve homelessness, and yet, with cumulative and time-sensitive workloads, it's often difficult to feed back on your frontline expertise. The main way that we do this is through our annual Frontline Network survey. Our latest survey took place in November and December last year, and we heard from 1,182 frontline staff across the UK. We asked you a range of questions, from how easy or difficult you find supporting people with things like access and accommodation, health services and benefits, to your experiences in working in this sector and what can be done to support your professional development and well-being. We released a series of reports covering the results of the surveys, and this will help inform our decision-making going forwards. These were the key takeaways from this year's survey. Firstly, that most frontline workers are seeing an increase in need and demand for their services, whilst at the same time there were significant issues when it came to access and accommodation for people facing homelessness. Secondly, frontline workers are working under extremely challenging circumstances, with workload, pay, job security and cost of living crisis all being significant factors. Thirdly, going forward, if we are to address homelessness, we need to ensure that the right resources are available. This means accessible, suitable accommodation, appropriate wider support, removal of barriers to access and accommodation, and improved policy and practice. You highlighted a number of areas where change was needed in order to better prevent and relieve homelessness. We have used these insights to help design today's event. Accommodation. You shared that access to safe and suitable accommodation remains a fundamental issue when trying to address homelessness. For example, 90% of survey respondents said they found access in private rented accommodation for people they supported very difficult or difficult. You can join a session discussing the growing issue of temporary accommodation later this morning, or our 4Nation update on housing legislation. In terms of support services, you highlighted that accessing wider support for people you worked with was also challenging, particularly in relation to mental health. The most frequent barriers to accessing support services that Frontline Networks observed were long waiting lists, difficulties providing necessary documentation, and digital exclusion. 88% of you reported that long waiting lists often or always presented barriers when accessing support services. We'll be discussing some of these themes in our upcoming sessions on health and homelessness and immigration advice and guidance. And your own well-being. You shared that high caseloads, a lack of time to do your job effectively, and barriers to access and training were serious concerns that impacted both your well-being and your ability to support others. The majority, 58%, of frontline staff felt that their role had a negative impact on their well-being. Job security, low pay, and having managers who listen and actively encourage professional development were all identified as areas for improvement. This afternoon's sessions will all look at support for different aspects of your well-being, from exploring tools for resilience to discussing how to practice mindfulness and self-care. So, whilst there is brilliant work taking place across the UK, there is clearly wider change needed to improve conditions for frontline workers and to address homelessness. Your insights as frontline staff will be crucial in informing the next steps. If you're not familiar with our work, do take a look around our website to learn more about the funding, community and resources available to support you as a frontline worker. You'll also find links here to local frontline networks such as Frontline Networks in Scotland, Wales and Northern Ireland. We'll be sharing a link to this in the chat, along with where you can sign up to our monthly e-newsletter, which rounds up news, events and opportunities relevant to frontline staff. If you do one thing today, please register to receive these updates. You don't have to take our word for it. Hear from some of our colleagues. Our strength as a network is in our numbers, so please do get involved and spread the word. I'm now delighted to kick off this morning's roundtable discussion, and it's great to welcome Katie Dalton, Mark Baillie and Jeremy White to the session.
Bore da a croeso I gynhadledd heddiw. Good morning, everyone, and welcome to today's conference. It's absolutely fantastic to be here. My name's Katie Dalton, and I'm director at Cymorth Cymru. We're the representative body for providers of homelessness and housing support services in Wales, and we're really proud and privileged to run the Frontline Network Wales. So it's been an amazing few years working with the Frontline Network centrally, and being able to represent the voices of frontline workers is one of the things I'm most proud about in this role. So today's session is all about the views of our colleagues from across the four nations about the impact of homelessness in their areas, but also the amazing work of frontline workers. And just to reflect really on the incredible work that you've all been doing, the extraordinary efforts that you've made during the pandemic and ever since. But we know that homelessness is increasing and accessing housing and support has become much more difficult. And Viki certainly highlighted some of the challenging results from the Frontline Worker Survey. So 78% of you said that demand for your service had increased. 91% said obtaining specialist accommodation for people you support was very difficult or difficult. And there were similar figures for accessing both private rented sector accommodation and social housing. And not only that, you talked about challenges in accessing support services and other services as well. So 75% of you said it was difficult or very difficult to access mental health services, and very difficult to access support for people struggling with mental health, addiction or trauma. And some of the barriers that you talked about included long waiting lists, providing documentation, digital exclusion, language barriers. Those were some of the common barriers, as well as, I'm sure many of you will agree, the welfare system. 63% of you thought that keeping the LHA rate frozen would increase homelessness significantly or slightly over the next year. And as well as those pressures externally, we know that there's not been a meaningful increase in resources for the sector in any part of the UK, and that's increased pressure on you and your services. And we know that, you know, resilience has been really strong, that you are absolutely incredible during the pandemic and kept going in the most difficult of times. But you're saying that, you know, 40% of you said it was difficult to have time to do your job effectively. 44% said it was very difficult to have time to undertake training. And as Viki highlighted, 58% said that the role had had a negative impact on their well-being, and that's just heartbreaking to hear. We also heard about the cost of living pressures, and that's something that here in Wales we've shone a massive light on and got significant media coverage on those issues. And some of the results from the UK Frontline Network survey absolutely reflected the experiences here in Wales. 64% of you said that fuel costs related to work were putting an extra strain on your personal finances. 32% said you were struggling to pay your housing costs, and 41% were struggling to pay bills. So very much seeing those of you who are helping people out of homelessness, in many cases being pushed closer to homelessness yourselves. And that's something that we don't want to see. And collectively, using your voices, we hope to campaign for improved support for you across the sector. And certainly in Wales, we have some government groups set up looking at workforce, looking at pay, looking at support for staff, and a range of other issues to try and improve the working conditions that you're operating in. So, lots to think about there. I think what really gave me a reason for optimism was seeing some of the values that you put in that survey that Viki so expertly guided us through at the start of today's session. Compassion, kindness, empathy, resilience, integrity. Those are all the things that we certainly hold dear about this sector, and you should absolutely be proud of those values. And we always talk in the sector about how it's more important to have those transferable skills. People can learn how to do support plans and risk assessments, but being able to build trusting relationships and show compassion to people are the most important things in this job. And it's clear to say from the survey earlier that there's absolutely loads of that in the audience here today. So welcome and thank you for everything that you do to make a difference to people's lives. So you've heard already from Viki, but we're joined, I'm delighted, by Jeremy White from Homeless Link in England and Mark Baillie from Homeless Connect in Northern Ireland. So a full 4 nations representation on this session today. So Mark, if we come to you first, just to introduce yourself and Homeless Connect to those who might not be familiar with you.
Thanks, Katie. Yes, good morning, everyone. My name's Mark Baillie. I'm Policy and Public Affairs Manager for Homeless Connect. Homeless Connect is the representative body for the homelessness sector here in Northern Ireland. We used to be known as the Council for the Homeless and changed name in 2021. We also have the privilege of being the Frontline Network partner in Northern Ireland. And we are at a slightly earlier, or slightly late, we only began slightly later than some of the other networks in 2021, but it's been a real privilege for me to have had the opportunity to play a role in facilitating the network here and in getting to meet lots and lots of frontline staff right across Northern Ireland. We're facing really challenging times, for various reasons, which I'm sure we'll touch on as we go on this morning. But I'm looking forward to contributing to this discussion as we go on. All right.
Thanks very much, Mark. And Jeremy, if you'd like to introduce yourself, please.
Yeah, thank you, Katie. No, it's a real privilege to be here today and really lovely to see so many people joining this day. So no, I'm really thankful for the Frontline Network for inviting me to come along and share stuff. So I'm Jeremy White, Head of National Partnerships at Homeless Link. So Homeless Link, we're the national membership body, so membership charity for organisations who are working directly with people who become homeless in England. So I've been in my role now for just over 6 months and absolutely loving it. So having that national role, it's a real privilege and pleasure getting to go out there and see lots of really great work and lots of good practice and things happening across England, as well as really understanding a bit more about the challenges that different organisations like yours are facing, and also local authorities and local public bodies, and really trying to work to get those different organisations to work together better in partnership. So we've got a team of 6 partnership managers spread across the UK who do some really fantastic work to lead on various forums and groups and partnerships, some of which some of you might be involved with. So no, really, really great to be here with you all today.
Thanks so much, Jeremy. And yeah, I think those of us who are here from representative bodies just feel utter pride to be representing your voices. It's all well and good speaking to chief execs and representing them, and we know that they try their best to represent frontline worker voices, but there's nothing quite like speaking to you about your experiences in your words. and we're all really, really committed to making sure that decision makers in whichever parliament across the UK, hears your voices and acts upon them. So we've got some questions, but I'd really love to encourage you to submit questions for the panel using the Q&A panel. So please do get your questions in there and we will come to them. We're running until about 11:30, so I'm sure we'll have time for your great questions. So first of all, how can we, other homelessness organisations and the government, empower and enable frontline workers to have their voices heard and influence that policy and practice in each nation? Viki, if we could come to you first and get your views on this question, that'd be fantastic.
Lovely, thank you, Katie. I might be biased, but I think the Frontline Network surveys are a really great evidence-based tool that we can use to gather opinions in and use them to inform both policy and practice. I also think organisations could be making sure that there's opportunities for frontline workers to network and to learn, so building sort of learning opportunities. And we've already heard that frontline workers are really overstretched. They've got high caseloads, that well-being's affected. So being able to build in some of that extra capacity for personal development and to take time, to think about the bigger picture and to think more strategically and feedback, what they're learning in the front line day to day to key decision makers. And probably more so for government and for decision makers is making sure that there's a feedback loop. So nobody wants to take time out of their busy days to, fill out a consultation or to go to a focus group and not know what's happened with that information. So I think if there's a feedback loop informing people of what's happened with their opinions, any change that it's affected, and if not, why has that change not been possible? I think that's really important, and it's quite often the piece of the jigsaw that's missing. And so people get fed up, of constantly being asked very similar questions over a period of years with nothing seemingly coming out of it. So I think being able to have more of that would be useful.
Definitely. And, I think that having that time and that encouragement to engage in frontline network activities is so critical. And sometimes that, that just doesn't happen. And certainly reflecting on the Frontline Network survey, that 40%, felt that they didn't have enough time to do their job effectively. You can then kind of see the consequences of that in terms of time for other activities within the job, which are so valuable. So I think there's a very clear message there to leaders and managers within organisations to help that. And I thought your point about the feedback loop is absolutely critical. We don't want frontline workers to feel that they're just kind of shouting out into the ether and that nothing's happening as a result of it. Mark, you said that you're quite early on in the Frontline Network in Northern Ireland. So I guess what are your kind of aspirations and plans for doing exactly this, making sure that frontline workers in Northern Ireland are able to have that influence?
Yeah, obviously we're in Northern Ireland, we're in a bit of a different context from in GB, in that we don't have an operational executive and assembly, which is causing all manner of challenges for us. Nonetheless, though, we are very keen to ensure that the voice of frontline staff the voices of frontline staff are heard in departments and by our politicians as we continue to see the negotiations go on around the executive. So in the last year, we launched research on staffing challenges in the Northern Ireland homelessness sector, which was quite a sobering experience and again, what it showed was in Northern Ireland, and I'm sure it's true in GB as well, we have a passionately committed workforce who really want to make a difference in people's lives and want to strive for a socially just society here. But we're facing major difficulties with pay and conditions. Many services here are struggling to recruit and retain staff. We've been facing funding freezes for many years. The main funding stream here supporting people has been frozen for 15 of the last 16 years. And that obviously feeds through to impact on frontline workers as well. But what we've tried to do is we've really wanted to amplify the voice of frontline workers in our engagement with policymakers. So we've had frontline staff up at the Assembly, both speaking at the launch event for the staffing challenges research, and we had the Frontline Network at the all-party group on homelessness, which was a brilliant session. It was excellent to hear directly from staff who are at the front line. There is a difference between the voice that you can bring, rather than just always hearing from the CEOs all the time. And again, I think one of the aspects of the job that I love the most is going out and visiting projects and visiting people, frontline staff right across Northern Ireland. And I carry with me, when I go into meetings with politicians, the faces and the stories. It's not, and again, I really want to encourage people to tell your representative bodies and speak through the Frontline Network, to tell us what's going on. Because we can bring that voice with us, and the passion and the energy and the engagement that we have with politicians and with policymakers.
Definitely. Thanks, Mark. And yeah, fantastic that they've been able to go into the Assembly and start having their voices heard. Something that we try and say to people in Wales is the Welsh Parliament is everyone's building. It's not just for the politicians or for the elite, it's for everyone to have a voice. And it's fantastic that frontline workers have already been there for a visit and raised their views there as well. And Jeremy, England is a much more vast country than the other nations. So I guess this is more complex for you, but what's your kind of view on how organisations and government can empower frontline workers to have their voices heard?
Yeah, absolutely. I think there are a few things. So I think local forums can be a really great way of building relationships and developing some really good partnership working across both the kind of frontline and operational as well as strategic levels. I think joining those things up is really important. I think those kind of local forums and groups and partnerships can be a really powerful and productive place for frontline staff to really share their experiences and challenges and feed up to decision makers and policy makers. I think that whole thing around speaking truth to power is really, really critical. And I think actually when those decision makers and policy makers start hearing that evidence of what's happening on the ground, I think they do stand up and take notice. That's certainly been our experience in terms of the intelligence gathering and reporting that we submit to the Department for Levelling Up Housing Communities as part of the role of our team within Homeless Link. You really see that in terms of hearing what people on the ground are saying and how that's used is really, really encouraging. I think it's really important, in terms of how you involve those decision makers and policy makers. I think it's really helpful identifying who the key sort of statutory stakeholders, who those people are, and creating links to relevant governance structures as well. Like now we have local integrated care boards who should be very interested in terms of the health needs and the wider needs of the people who we're supporting in services. There's the health and wellbeing boards, homes and community boards within local authorities, and also safeguarding boards as well, who are very, very keen to listen to what people on the ground are saying. And I think actually, as Viki said, I think that point around feedback loops, I think that's really important to ensure that those really robust feedback loops are in place that can really strengthen the voices of frontline staff working across the sector, making sure that these things aren't just, talked about or heard about in these forums, but actually there's that feedback loop of saying, okay, this is what we've heard and this is what we've done with it. I think that can be tremendously powerful and also really encouraging to know that, that is actually going somewhere in terms of making a difference and making a change in how the system works around people.
Yeah, definitely. And I think, there's some kind of key themes, I think, that's come from all of your answers, that thing about feedback loops, which I think, all too often many of us fail to do, because we get something done and then we're on to the next thing. But making sure people understand how they've influenced that, whether that be frontline workers or people with lived experience, is really important. That point that Viki made about time and space to engage, and the role that leaders in organisation can play in making sure that frontline workers have the permission and encouragement to do do that on a regular basis. The point, Mark, you said about carrying that with us nationally. So those of us who sit on national government groups, always carrying those voices from those interactions. And Jeremy, as you said, linking in with the right group strategically. So how can we make sure that those voices are heard in the right places at the right time? And certainly here in Wales, we've managed to facilitate really positive engagement between government and frontline workers. And frontline workers here in Wales have had a really significant impact on both the workforce task and finish group that the Welsh Government established, kind of influencing the work plan for that. Also having a couple of frontline workers sitting on the task and finish group alongside more senior people, and being able to really influence and shape that. And then another thing is the outcomes framework that sits around our housing support grants. Frontline workers have had a really, really significant impact on that, and that's because engagement happened at the start of the process and then checked back in at the end that the government had heard them correctly. So I think we are making strides in Wales, so much more to do, but I think there's some important steps being made, and it's certainly something that I'm really proud of. The next question that we've got is, what key lesson would you offer from your nation to tackle homelessness? So I'm going to start with Mark this time, if that's okay. So what do you think that the lesson is from Northern Ireland in terms of being able to tackle homelessness?
I think my instant response to that is that the danger of fatalism and responding to the challenges that we have. We're in a difficult environment. And it's often it can be this sense that it doesn't matter what we do, it's just things are just going to keep getting worse. And I really passionately believe from the work that we're doing that we have to avoid that temptation to think that things will continue to worsen. I passionately believe that with the right policy and the right resources, you can prevent and reduce homelessness. And indeed, in Northern Ireland, we see our frontline staff doing that every day, preventing and supporting people to transform their lives as well. The difficulty we've got is that we don't have a functioning executive. We've got a captainless ship, which hasn't got someone steering us in the direction that we want to go. But at the same time, we've got to keep going and keep fighting for the people that we are looking to support, and not allow fatalism to creep in and stop us from trying to seek better outcomes.
Definitely. And Jeremy, what again, complex situation in England, but what would your reflection be?
Yeah, so I think, it was really interesting when the whole Everyone In programme happened. I think at that time, so in my previous role, I was a commissioning manager at Bristol City Council, so it was a huge privilege being a part of that locally here in Bristol. So I think that really identified many key lessons for us. I think in terms of how we prevent and how we end homelessness, and how I think overcomplicated that we can make it sometimes. And actually it's just when we all muck in together, and when we all realize that we're going after the same thing, and you drop those barriers in terms of, somehow, I think sometimes organizations aren't always working together in the best sort of coordinated way. And I think what everyone gave us, and, in a way, was that opportunity to kind of look at how can we best utilize the funding, how can we create those sort of flexible funding or service delivery models, and really develop strong partnership working. I think, all those things are really key to tackling local homelessness challenges, because so often I think the way that strategically, the way that things are commissioned and the way that organizations work together, I think from a commissioning or from a government perspective, is sometimes organizations are actually put against each other inadvertently in terms of how, you bid for different services, and it can become quite a competitive sector very easily. And I think Everyone In was just that real opportunity of actually, let's think about how we can approach this differently, which I think is really positive. I think, in terms of the work that we do at Homeless Link, so with the partnership work in particular, so that's work that we've pioneered and we've continued to support, around local partnership working across England. And that's really with a view to enabling stronger local strategic partnerships and developing better coordinated, strategic and partnership approaches, really to support that wider aim of preventing and ending homelessness and rough sleeping. So we've done that for the last sort of 8 or 9 years now, with funding from DLUC and London councils. And we're currently in the process of developing a partnership self-assessment toolkit as well, which I'm really keen to plug. So that will really provide a framework for local areas and partnerships to assess their partnership working based on 5 key markers, which are clarity of purpose, connectivity, collaboration, co-production and communication. And our real vision with that is that it will support senior leaders across local authorities, local public bodies and VCS organisations and faith-based organisations as well, to really work together better in terms of developing and implementing robust action plans, to ensure local partnership working is really effective and that it's sustainable and it is delivering tangible results. And I think, also to say we're very excited to have some funding from St Martin's charity as well to set up the homelessness practice incubator. So that's a new exciting programme of work that will really allow us to gather and test, I think, better ideas in terms of tackling homelessness, which aren't currently mainstream. So that feels like a really exciting opportunity. And I think there's a lot of real potential for identifying and testing and proving new and better ways of working that will hopefully inform good practice around tackling homelessness.
Definitely. And I think if there's anything that we need to retain from that experience in the pandemic is that cooperation, that partnership working. And, I think some would argue the reduction in bureaucracy that enable people to move much more swiftly. Viki, from a Scottish perspective, what do you I mean, there are probably lots of lessons from Scotland. You're always pushing ahead with more progressive legislation and policy. So, but from your view, what are some of the lessons that can be learned from Scotland?
Yeah, so I think Scotland's had a number of quite successful kind of policy interventions. So the abolition of priority need, which was back in 2012, and that's significantly reduced the number of people who've got rough sleeping in Scotland, although, temporary accommodations fit to bursting and there's long waits in temp, we do have far lower numbers of people rough sleeping than in other areas. And we also have a rapid rehousing approach, so that sort of prioritises access to settled housing quickly and sustainably. So that was a national government sort of initiative, but it was devolved to local government. So all local authorities had to come up with their own rapid rehousing transition plans. We've also got a commitment to house building. I think, though, what's also key has been policy development. So the Scottish Government have had a number of task and finish groups. I know you were just speaking about them, Katie, in Wales. We've had a series of task and finish groups. And homelessness sector workers have been really influential in there. So hearing directly from people working in services. But on top of that, I think lived experience. So the Scottish Government have been really willing to listen to the voices of lived experience in policy development and have actively created forums for people with lived experience to come and to give their opinions. And there's been a real sense of them being listened to and acted on, which I think is crucial, and it makes for more successful policy interventions. When people that have been experiencing homelessness or who are currently homeless are asked for their opinions and what would make the situations better. So I think that's, if I was to pick one, I think it would be that.
Amazing, fantastic one to pick there. And I think probably, we've heard about, trying to avoid that fatalism, from Mark in Northern Ireland, the coordination and partnership from Jeremy, and then, a number of things from Scotland, but particularly Viki passionate about the lived experience. I think, here in Wales, it's probably the prevention legislation that we brought in 2014 certainly saw a large proportion of homelessness prevented for those people who were approaching their local authority after that legislation came into being. I think, looking over the border in England, probably maintaining the ring fence around what was supporting people and is now housing support grant, although we would all desperately want more funding in that pot, the fact that it still remains, I think, has been incredibly important. And also, I think our work on taking trauma-informed approaches, which I know is shared across the nations, has made a real difference to people's experiences. Thank you so much. Moving on to the next question, and it touches a bit on some of the things that Jeremy was talking about. So in terms of cross-sector approaches, how do we move homelessness up the agenda in other related areas such as health, social care, and education? Jeremy, do you want to kick us off with that? Because you had quite a focus on partnership and cooperation there, and a multi-sector approach is important, isn't it?
Yeah, no, absolutely. So I think, considering everything that I mentioned already around, integrated care boards and the integrated care system and how things are working, I think those real close working relationships with adult social care, health and education, I think it's important having that real impetus and buy-in from a senior level that then is fed down. I think it's making sure that these things are really joined up. I think kind of adding to it a bit, I suppose it's around, bringing colleagues and partners together across these different sectors. I think that's really key. I think ensuring that homelessness is really recognised as a key issue, I think that can be addressed not only within the context of housing as a housing issue, but actually using data and evidence to suggest that there is a much clearer link between homelessness and poor access to those things like health and education and social care. I think there's a lot of evidence out there that really supports and suggests that, but as I said, I think it takes that real impetus and buy-in from decision makers and strategic leaders to be working across local authority. I think the different directors and directorates in local authorities, as I've said, that's very, very important. And I think encouraging and enabling and really providing those opportunities for people with lived experience to feed into those spaces, and also for frontline workers to share their views. I think it goes back to what I was saying before, really, just making sure that those feedback loops are in place. I think I also wanted to mention just briefly about some work we've been supporting around developing legal literacy. So that's been really about understanding what people's rights are and how to advocate for them. So we've produced a range of safeguarding resources, including some bite-sized training sessions, which are all available on our Knowledge Hub. So what I'll do is I'll pop a link to our Knowledge Hub in the chat so people can access that as well.
Brilliant. Thank you so much, Jeremy. And Viki, how about in Scotland? How are you guys trying to move homelessness up the agenda of those other public services?
Yeah, so I just wanted to echo really what Jeremy was saying, about homelessness. It's often seen as kind of a singular issue or a housing only issue. And for some, it is only a housing need that needs to be met. But for many others, they really need that sort of wraparound support, and for people to be seen as a whole person, and not in isolation and kind of different services dealing with singular issues with nobody really having oversight of what, the whole needs of a person or of a household. And so I think in terms of moving homelessness up the agenda, I think we need policy interventions, although they obviously need to have adequate capacity and resource put behind them. And I think through demonstrating what is possible via best practice and evidence of the correlations between homelessness and those other facets of people's lives, I think, demonstrating the art of what's possible, I suppose. In Scotland, we've got a housing bill coming. It's due after summer recess, and that's going to put a duty on public bodies to ask and act about homelessness. It's not entirely clear how health services will be involved in this yet, but it's likely health and social care partnerships and our joint integration boards will have some of this duty placed on them. I think that, demonstrating through best practice. So Cyrenians have a hospital in-reach team, so we have a team of people based in the hospital, and when somebody's admitted to A&E, it will flag up if they have no fixed address, so our team will go in and kind of speak to them, and I think that's been great, and the hospitals found it really, really helpful in being able to learn from each other, I suppose, and to really build up those close relationships and partnership working. And it's had amazing outcomes in terms of decreasing presentations to A&E and obviously decreasing spending from the public purse because of the cost of people presenting to an A&E when their health issues could have been seen to earlier, which would be better for the individual, but better all round, I suppose.
Thanks very much, Viki. And Mark, recognising that you don't have an executive at the moment, so everything feels a little more difficult. But yeah, do you have any other reflections on this issue?
Yes, it's thanks for reminding me of that depressing.
Sorry, Mark.
Yeah, I mean, I think not only do we not have the executive, it kind of feels like we're in like a perma crisis with and if I use another fancy term, poly crisis, with numerous crises affecting our whole system, from health, education. I mean, it's incredibly challenging. But with that said, I think during COVID, we actually saw some barriers come down, particularly with regard to working with health. It was quite amazing to watch what can be achieved when people really believe it is an emergency, that you really have to move quickly. We saw some of the siloed mentalities that have been very dominant, unfortunately, in Northern Ireland, and some of that's creeped back in post-COVID, but we've had some slippage in that. But there have been permanent gains in some areas. We've particularly seen, we've got each of our 5 health trusts now have homeless health nurses, which is a really positive thing. There was a new service opened in Derry, Londonderry in the last couple of weeks, a new hub up there, which again was a very positive development and came out of relationships that have been built and formed in recent times. And I think one area we find very challenging in Northern Ireland is getting the Department of Education to see that they have a role in responding to homelessness. I mean, that has been very challenging to get them, because basically their response to every request we make is, this isn't our responsibility. And we don't have the money for this, so we feel unable to act. And really the challenge there is that you have to get buy-in from the right across the system. Because basically what will happen is, if you don't get that buy-in, you're going to keep on seeing some of the same problems emerge again and again and again. So there have been positive developments, but we're facing an uphill climb in some regards in Northern Ireland.
Yeah, absolutely. Solidarity, Mark, to you from the rest of us. So yeah, some really good points there. So buy-in from a senior level, incredibly important. Otherwise, I feel that you have some passionate individuals running about doing brilliant things, but it's not hardwired into the system, and that's what we need for that sustainability. Bringing partners together to understand each other's viewpoints and pressures and the opportunities, capacity and resource. I mean, certainly here in Wales, we'd be looking to health to do more, and they'll be saying, have you seen the pressure on our services already? We're absolutely full to capacity, and it'd be really, really difficult. I think really good point about evidence and demonstrating what is possible. Because I think too often, and as Mark alluded to in a previous answer, it can feel impossible to so many people. And if we can demonstrate that it is possible and it can have a positive impact, then that can have a massive impact. Ask and Act up in Scotland, and we're going through a review of legislation at the moment, and I sit on an expert review panel that's considering legislative proposals, and one of those areas is whether we should put duties on other public services such as health and others, to identify someone at risk of homelessness, to cooperate in terms of their action in response to that, and to refer onwards to homelessness services where that is appropriate. So again, that's something that's been shaped by frontline workers, and those recommendations will be going to the Welsh Government at the start of September this year, and hopefully frontline workers in Wales will see their fingerprints all over some of those recommendations. And really great though to hear, Mark, about the homelessness in each of those areas. I think that's a really, really positive step. Here in Wales, we've done work over the years to try and link administrative data between people using housing support services and track the impact on people using A&E services, inpatient hospital admissions, and that tends to show that people have an increase in use of those services, and then once they receive that support, that use kind of deteriorates. So trying to show the benefits to health services of being able to provide that appropriate support from housing support services. I think funding, where you're able to kind of bring funding together. In Wales, we've had some complex needs funding from the Welsh Government, which is health funding, but in partnership with the homelessness department, and that has encouraged people to get around the table and then bring other funding to the table to bring about some multidisciplinary teams in some areas of Wales. So I think sometimes that bit of extra funding nationally can spark some of that collaboration locally and regionally as well. And we've just had a health inclusion group set up as a subgroup to our Ending Homelessness National Advisory Board. So I think appetite to do work in that area, my view is that at the moment it depends on passionate individuals and isn't necessarily hardwired into systems, and we'd definitely like to see more of that. Brilliant to see some questions coming in the Q&A. We'll come to those in a short while. So the next question that we have, and I think it's time to go to you first, Viki, trying to rotate so no one feels like they're being left out or not being loved as much as anyone else on the panel. Can you share an example of good practice from statutory homelessness or housing services where they're working in a flexible, inclusive way with people?
Yes, I can. So in Edinburgh, we've got our outreach staff can complete homelessness assessments. So that's probably a nice quick one to say. We also have an interagency street network. So it's weekly meetings between staff from homelessness organisations, health, social work, housing, and in these we share sort of intelligence on people that we've met or come across in the streets. It can even extend to parking attendants and park rangers, and anybody really that's working in the town centre can sort of come along and give us information. And one of the key things about that is that people don't have to retell their stories, so they're not coming across different outreach workers from different agencies, different healthcare providers, and having to retell everything. So that's one of the key things. I think, so I'm lucky enough to have been part of a road shows. There's a project that we have called the All In for Change team that I'll hopefully get a chance to speak about shortly. So we did a sort of national road show and got some really good examples of flexible working across Scotland. So in Aberdeenshire, people can keep the same contact person throughout their journey from homeless application to being in their permanent tenancy. There's also really good examples of partnership working across third sector organisations and East Ayrshire Council, and they have a coordinated approach to supporting young people, and the housing teams directly linked in with the Universal Credit Support team. So yeah, I've got quite a lot of good examples, but I'll not hog the time too much. But yeah, but I think it's really, and it goes back to somebody talking about one of their values being optimism and Mark talking about fatalism. I think, it's important to see where there is good practice and really sort of shout about that and shout about what is possible. But I know it's so difficult, when you're working under extreme pressure and, it feels like every day is a crisis. But I think, where we can see these chunks of really good work being done, it's important to sort of highlight and shout about them.
Definitely. Mark, was there anything that you wanted to add briefly?
Yeah, sure. Just on that point, Viki, absolutely right. Even in challenging moments, there are positive things happening right across the UK. And I know in Belfast we've been really pleased with the progress that's been made through Complex Lives, which has come in. I know it's a process it's a method that's been used in parts of GB as well, Doncaster in particular. And we've really seen, the coordination of services in Belfast that get to a level that it had not reached before, and is beginning to bear fruit in terms of better outcomes for people experiencing chronic homelessness in Belfast. So we're really encouraged about how that's been progressing, and hopeful that we can continue to see that flow in the months and years to come.
Great, fantastic. Jeremy, was there anything that you wanted to add?
Yeah, I think there are probably a few things. I mean, I think from a strategic level, I think it's, some of the stuff I referred to earlier around that sort of real joint commissioning around, homelessness and housing, working closely with other directorates like adult social care, like public health, really looking at what are the issues across and how can we really work together in a more flexible, inclusive way. I think a couple of specific examples for something that I was privileged to be involved in developing in Bristol was the whole idea, which I think Viki sort of mentioned something very similar around a trusted assessment, where instead of expecting or asking somebody to share their story, which can often be really re-traumatizing for them and also re-traumatizing for staff, having that process in place where they only need to share their story once and then that stays with them throughout their journey, whether that's in terms of being supported by a new agency or going through a pathway of services or meeting a new support worker or someone new, or another agency, making sure that we're being really careful around providing a truly psychologically informed framework and environment for people. I think stuff that I've seen that has worked really, really well in Bristol and definitely other places across the UK is having co-located outreach and assessment hubs where local authority, housing advisors or homelessness advisors are sat in the same place as outreach teams to really ensure, I guess, a more dynamic and flexible approach to supporting people. That's something that I've seen works really, really well, just making sure that those things are really joined up. And I think it's statutory services realizing that there is so much more potential. I think for them to think outside the box and take other approaches, they don't have to be stuck within the offices, of the council, 5 times a day. They can get out there and do some of that co-located stuff, which is really good. And I think just one other thing quickly. So there's, I think one of the key issues that is sort of been around for quite a long time now, and it's becoming increasingly more challenging, is around where clients that are being supported within homelessness services are experiencing really complex mental health needs, and where local, like for instance in Bristol, there's the local Avon and Wiltshire partnership, which is AWP, so that's mental health services, part of NHS. I think it's where these different partnerships within NHS can work a lot more flexibly with local authorities and local providers. And I think actually in sort of part in answer to one of the questions that I saw pop up in the chat, in terms of when you're trying to build partnerships, you can often encounter resistance, and there's often little time or will to ensure that there's proper impetus or buy-in from all those different parts I was sort of talking about, making sure that's truly established. I think case studies can be a really powerful way, and that's something that I found has worked really, really well. I think presenting a case to the right stakeholders, within those statutory organisations can be really powerful. I think reflecting back, look, this is what's happened. These are the things that went wrong. We believe that if we were to put these things in place going forward, that we would see much better outcomes. And you can start doing some of that testing and learning of taking those different flexible approaches. So I think it feels very exciting. I think all of the potential that's there for that better joined up working in terms of statutory organisations working in a more flexible and inclusive way, and also really important recognising and including the voice of people with lived experience in that process. And actually, if it's appropriate, it's been extremely powerful and moving sometimes being sat in a room with professionals, but with people lived experience really sharing their stories, and sometimes that can be really powerful as well.
Thanks very much, and that leads really nicely on to our next question. And after this question, we're going to go to some of the brilliant questions that put in the Q&A by attendees at this conference. But the next one is a big one and an important one. How are you involving people with lived experience of homelessness in your work? I think we'll go to Mark first this time, please.
Yeah, so I mean, again, this is something where we're a bit further back in our journey than some of the other jurisdictions in the UK, but we've been making some good strides. The Northern Ireland Housing Executive has committed during the life of the latest homelessness strategy to introducing a lived experience programme, and we at Homeless Connective we appointed our first lived experience coordinator. So we're really looking to try and develop the framework in which we can have people with lived experience influencing and shaping policy, not merely being spoken to about what's best for them, but actually giving them the agency to shape and form the policy that we need to have. So we're really, I'm encouraged by the progress we've had. We look at Scotland in particular, and that's where we would love to end up. And I'm sure Viki will be able to tell us about the kind of progress they've made. But we're a little bit further back, but I'm hopeful.
That's brilliant. And we like hopeful, Mark. We definitely like hopeful and optimistic in this situation. Jeremy, do you want to speak a bit about what Homeless Link are doing with people with lived experience?
Yeah, absolutely. So, I mean, in terms of the work of our partnership team, it's something that's extremely important and something that we're really working hard to properly embed. I think it can easily become one of those things that can be tokenistic if you don't do it right. I think something for us that's really intrinsically key and a part of what we're doing is making sure that people with lived experience are involved in projects or forums or groups or partnerships from the very outset. I think what can often happen is where you think, oh, we need to get this group or this forum or whatever it is, or this project set up, put in place. We need to get experts around the table in terms of people who have maybe worked in the sector for quite a while, or people who are very good at, with project management skills, etc. I think it's that missing ingredient at that point that is really crucial around making sure that people who are currently accessing or have used those services are involved in those conversations from the start. And I think it's really about supporting them in terms of developing a pathway for them to become involved in that work, really giving them the support that they need through that process. And I think it's, again, that stuff around having a feedback loop where you can really use their experiences and their voice in terms of how you shape and how you direct those things going forward. And there's some wider work that we're doing as an organisation, which I've got the privilege of leading on, around really looking at wider what our approach to lived experience is. So there's some really exciting work happening in that space, which I'm hopefully looking forward to share a bit more at some stage. But there's also, through our Women's Homelessness Project, we've engaged women who are accessing homelessness services to be a real part of the development of a set of principles for gender-informed provision going forward. So there's some really interesting work that our National Practice Development team are working on in that space as well.
Oh, brilliant. So lots of things going on there. Thanks, Jeremy. And Viki, last but not least, do you want to talk about some of the work that you guys are doing with people with lived experience?
Yes. So I mentioned the All In for Change team in the last question. So the All In for Change team, it's a partnership between Cyrenians and Homeless Network Scotland. So there's good partnership work going on there. And we receive funding from St Martin in the Fields for that as well. And what we are is a group of people with frontline and lived experience of homelessness. And we're funded to provide a bridge between Scottish Government policy and what's happening on the ground. And we have a representative, at least one from Scottish Government, that comes to our monthly meetings. And I think, Jeremy's point about involving people from the outset, I think that's really key. So nobody wants to be given sort of a finished product and asked, what do you think about that? I think being involved in the whole process and really making efforts to co-produce with people, and I think that's key. Also within our organisation, even down to our recruitment processes, and we've got a significant number of people that work for us have lived experience of some form, so whether that be of homelessness, poor mental health, or addiction. So another service that I manage is a residential rehab accommodation, and out of the 6 of us on the staff team, 5 of us have lived experience of addiction, and I think that's so important, not only in policy but also like service design and service delivery as well. So having people there that can really shape what you're doing, and listening out to people that are using the services as well. So we have fortnightly residents meetings, and we have a wellbeing programme that people staying in our accommodation can shape. And I think all of that's key, really. It makes for better services, it makes for better policies, it makes for better implementation. I could talk about lived experience all day, so I'll let you move on.
Oh, thanks so much, Viki. And I think all of us could talk about lived experience all day long. It's such an important issue, and you're right, all of those different levels. So whether it's policy influence, service development, working within the teams that are delivering these services, it's also important. And briefly here in Wales, I mentioned that we've been going through this review of legislation, and Cymorth has led the lived experience work there, and we've engaged with over 300 people who have fed in their views to the expert review panel on legislative reform. And when we first agreed to do it, I was terrified of just it failing and only kind of 3 people wanting to talk to us about legislation. But I think I think the lesson for us is just do it. Like, don't let perfect get in the way of good, actually. And we used a variety of different ways. So we did everything from speaking to people on the streets, to visiting our members' projects, to holding events with buffets. Importantly, I think food and refreshments is always really good, and working with other partners to try and engage with people, and even going into one of the local prisons to speak to groups of people about their experience of homelessness. So I think trying to use all of those different ways, as well as things like online surveys and one-to-one interviews online, as well, has given people a range of different ways to engage, and then their views have been written up into papers that have gone to the expert review panel in advance of every meeting, focused on the topic that meeting is considered. And the chair, Professor Suzanne Fitzpatrick, has said, before we get into discussion and decision, we're going to hear from the people with lived experience, and we've been able to kind of set up the topic of discussion with the lived experience viewpoints at the very beginning. So it's all focused on that. So we're really proud of that work, not perfect, but more to do, but we're really, really enthusiastic about it. We've got about 15 minutes left, and we're going to go to some of the questions in the chat now. So if we can be maybe as succinct as possible, we'll hopefully get through a few of them before we have to finish up. And we've had a great question from Rosie. Given that care experience people are so much more likely to experience homelessness, is the Frontline Network and your organisations engaged with the campaign to make care experience a protected characteristic, or do you have views on how we can ensure people with care experience backgrounds can have that extra support? I forget who was supposed to go to. I think Jeremy was next to go up first. Jeremy, do you have any views on this?
Yeah, so I think and maybe linked to some of the stuff that I was referring to earlier, I think it's really understanding those care needs from both perspectives from a homelessness issue. I think it's where I think it's stuff around multiple disadvantage, or what can also be often, I guess, labelled or referred to as multiple exclusion. I think it's understanding what those key issues or needs are, that people have in terms of, I think there's some really useful data and evidence out there, again, when you're looking at these different case studies in terms of people who are experiencing really chronic health issues, and it's the impact that has in terms of your lifestyle, how you can go about your everyday life, how you can manage things. I think it's really important to understand, I guess, what those pinch points could be in terms of what stage does somebody become at risk of losing their home or face some type of homelessness. And I think it's that join up. I think it's understanding. I think what's really challenging is where I think in a care system you have your different frameworks, you have quite a specific language or a way of looking at different issues, and I think that's one of the barriers that I've seen time and time again, is where it's often things are misunderstood or misrepresented in terms of a care issue, where, for instance, it might be within a local authority where, we wouldn't deem this person to be at risk of homelessness because it doesn't sit within our statutory framework. I think, again, it's sort of looking outside the box and really looking at the whole individual. I think it may have been Viki earlier sort of talking about that holistic approach. And I think having those spaces, I think going back to what I was saying in terms of those forums and groups and partnerships that can be so important, I think having something in place like a case review group where you're bringing together different professionals and different people across care, adult social care and homelessness, to really look at what those issues could be. And I think it's doing that preventative work really early on, in terms of, we know that this person is facing these issues from a care perspective. At some stage, it could become a homelessness issue.
Thanks very much. Viki or Mark, do either of you have any comments on this?
It's not something that we've considered yet, but I commit to have a look at it after this today. So thank you for raising it.
Thank you, Viki.
Yeah. So Scotland has something called the Promise. That's the commitment to people who have care experience and offering them sort of additional support. So Cyrenians have signed up to that. And actually our definition of a child, we've extended to, well, it's under 18s, but up to the age of 26 for anybody that is care experienced. So at the moment, we're undertaking children's rights and wellbeing impact assessments throughout all of our services. So we've got quite a push on that. And we've got child protection training for all staff. And yeah, I mean, I think that I've known so many people that have been through the care system, they kind of age out of that, they're given a tenancy, you know, and so many of them, they've never had anybody to sit down with them and show them how to set up a direct debit. You know, they don't know how their gas or their electricity is going to work. So I think it's really important to have additional support in place, you know, and a real awareness of people's needs, I guess.
Yeah, and Rosie, certainly at Commonwealth, we've not specifically talked about it becoming a protected characteristic in terms of the Equality Act, but, you know, I think we're acutely aware of the impact that being care experience can have on your life outcomes. And it's been a topic of discussion in the expert review panel, actually. And not only should, you know, about whether people who are care experienced have access to certain priority or level of support up to age 25 or something, but actually whether we should apply that for the whole lifespan. Because certainly, you know, some of the people on the expert review panel talked about people who are much later on in life, maybe in their 30s or 40s, but are still carrying the impact of their care experience. And therefore, when we're thinking about people who are care experienced, you know, should we maybe not limit that extra support or priority to just those early years, but actually make it more of a lifetime support and opportunity? So thanks, Rosie, great question. Briefly, if we can, sorry to put you under pressure, but we've had a flurry of questions in. So we've got one that's quite topical for this week. So briefly, what do you think of this week's royal pledge around homelessness? Viki, if we could go to you first.
Yeah, so I mean, I think any sort of attention or additional attention that can be given to homelessness, I think is always going to be welcome. So we don't usually see this much sort of press attention and interest in the topic apart from around Christmas time. So I think, you know, what is it they say, all publicity is good publicity. I do worry that, you know, it's that thing of being boiled down to, again, a singular issue, isn't it? And if it was an easy fix, then, you know, what have we all been doing for years, trying to work in the sector to improve people's lives and to end homelessness? So, yeah, there's a few concerns around that, I think, but on the whole, I think it can only be a good thing to have the extra attention put onto homelessness.
Thanks very much. And Mark, Northern Ireland is one of the places that is a flagship location. So briefly, what's your view on this?
I agree with everything Viki just said. I mean, what I will say is that the cut through, that it reached people that wouldn't take an interest in homelessness, that you know, and that was helpful. I mean, I think from our perspective, we're one of the partners, Homeless Connect's one of the partners with the Homewards project. I know, I'm sure you all are as well. The difficulty is there's a lot that's still not clear as exactly what it's going to look like as we go forward. So, but at the same time, I think there have been positive aspects to what was done.
Great, and Jeremy, briefly, your take.
Yeah,
as a partner.
I mean, we very, very much welcome it. I think it's really helpful, I think, in terms of helping to address some of the stigma around homelessness. You know, we've done a whole, and people can see on our website, because we're a sector partner with the Royal Foundation for this, which was announced earlier this week, which is a huge, you know, I think, opportunity and privilege for us as an organisation, along various others as well. So Rick Henderson, our chief executive, has written a whole blog on sort of why we're working with the roles. That might be useful for people. And again, I can pop that in the chat so people can have a read.
Great. Next question that we've got, a few of you mentioned issues with staff retention and or recruitment. What can we do to highlight the challenges of frontline work while at the same time encouraging people to join the sector? That is a very difficult dilemma for many of us. Mark, do you want to kick off first, please?
Yeah, that was a needle that we've been trying to thread. You know, I hope successfully. But again, it is really challenging. I think the aspect that what we've wanted to say to people is that when we did our staffing research, what came out of that was that you know, work in the homelessness sector matters. It has a transformative effect in people's lives, and if you want your professional life to make a difference, one of the best places to go to is to work in the homelessness sector. And I know that folks who are on this call this morning will know that will know that better than I do. But the difficulty is, so we're wanting to say to people, look, this is a brilliant sector to work in, but we really want the pay and conditions to match. We don't want that passion to be taken for granted or more cynically used, and abused by governing authorities, basically paying less than they should. So it's trying to keep those in balance. But we really wanted to encourage people to see this is a place you can make a difference. And that's one of the messages we would put out as well. But yes, it's a very good question and a constant challenge for it.
Yeah, definitely. Jeremy, have you got anything to add from an England perspective?
Yeah, no, absolutely. I think this is one of those key topical issues that has been coming up time and time again in terms of our monthly intelligence gathering that we do as a team, really listening to and hearing what the sector is saying. In all of the member visits that I've done since joining, it's been the big thing that all of our sector leaders and people working across services are saying is the big issue is around, issues around staff retention, recruitment even as well, and how we retain staff. There's something around, salaries aren't high enough in terms of keeping people sustained in roles. There's some really interesting work that we've been doing in conjunction with Chartered Institute for Housing in developing a new level 3 accredited qualification, which is for people working frontline homelessness services. Really, I think where often people going for these types of roles, it is because of a passion. It's wanting to make a difference. It's wanting to do something that will help somebody. And it's really trying to recognize that and turning it into more of a proper role rather than just something that is a vocation. I think it's finding opportunities to develop people in terms of their skills and their roles. But I just wanted to mention as well, and I'll put this in the chat, that there's a campaign that we've been doing, which is Keep Our Doors Open, which has really been campaigning and lobbying for inflationary uplifts, where we know that really the bottom line, I think, for people is around the salaries aren't high enough, and there needs to be recognition of actually really good and hard work done by people working in the services, and recognizing that there are some real skills required. It's not an easy job by any means. So I'll put that in the chat so people can have a read of that as well.
Thanks, Jeremy. And Viki, you're closer to the frontline as well, so I imagine it's something that you're acutely aware of.
Yeah, no, I think Jeremy and Mark have hit the nail on the head really with working conditions and salaries. I think if there was more capacity within services as well, so that frontline workers could have lower caseloads. So, because it is a really, really challenging job, but with the nature of, and I think Mark spoke about earlier, with competitive tendering, it's always, keep the costs down. And put the salary points as low as possible with as few staff as possible to run the service. And sadly, it's frontline workers and people that need to use the services that suffer because of that.
Yeah, and I think the approach we're taking is absolutely showcasing the amazing work of the sector. We've, really grateful Welsh Government put some funding into a recruitment campaign recently, which was aimed at people from outside the sector who might want to change career and do something more meaningful. So I think all of that's really positive. But at the same time, we're hammering the government, the Welsh Government, for not increasing the funding of the housing support grant. So I think for those of us in those representative positions, we have to kind of do that dual kind of approach really. Pleased in Wales that there's going to be some research very, very shortly on pay in the sector, and comparing some of those pay levels to other similarly skilled services and support services elsewhere. So hopefully some recommendations from that will come. I'm very clear, if we want to pay people the wage that they deserve, the Welsh Government has to put more funding in there. Thank you so much. Apologies we've not been able to get to all of the questions today. I've tried to pick out the ones that maybe had some themes for a few different questions. I'm sure those of you asking about the next election, I think the message from all of us would be optimism, that maybe we can have more clarity around social house building, that we can have more investment in public services, and that some of the disastrous welfare policies could be improved upon. But thank you so much everyone who's attended here. A huge thank you to Viki, Jeremy and Mark for sharing your amazing insight from the different nations. I hope you've enjoyed this session. I hope you found it informative. We're going to take a break now. Lovely to see Bendigedig Diolch. Excellent, thank you in the chat. If people could learn a bit of Welsh through this conference, that would also be excellent. We'll be back for some other sessions at 11:50, so please do check out your agenda, choose which one you want to attend, and I hope you have a fantastic rest of the day. Diolch yn fawr iawn. Thank you so much to everyone, and we hope to see you very soon. Thank you.